We're here with Jill Herzig, editor-in-chief of Redbook Magazine. And another topic they talk about in the February issue is women-specific symptoms of a heart attack.
Absolutely. Heart disease, I think we all know, is the #1 killer of American women. So this is a very, very serious problem. But a lot of women have no idea what the signs of a heart attack would be like in them. You know, it's funny, we're such caretakers, we know exactly what it might feel like in our husband. You might get the, those typical symptoms, like I feel like my arm is hurting or it's tingly, or I feel like I have a brick on my chest, I can't breathe. But we don't know what it would feel like in ourselves. So, women may actually be walking around kind of not telling anybody that they feel a little weird, but they're actually experiencing symptoms of a heart attack.
Still, over 50% of women will have some chest pain with their heart attack, but many women, it's these subtler symptoms: nausea, shortness of breath, unexplained fatigue, maybe jaw or arm discomfort. But what's really important, these women know something's wrong. So I'm not talking about the nausea you get after you ate a meal and it didn't settle well with you. This is I don't feel right. I need to listen to my body as a woman. So again, these subtle symptoms, women, you have to pay attention to these symptoms because they're different than anything you've ever experienced before. And you don't want to keep those a secret from your doctor, from your spouse, because the sooner you get treatment, the quicker you can hopefully stave off either damaging your heart muscle or even death.
Right. Well, as a gynecologist, a lot of times I'm the primary care doctor for women, and they'll have hypertension when they come in, and they'll just ignore it and ignore it. And I keep having to say, look, you have to follow up on this, and remind women.
Yeah. I'll just power through it. I'll be okay.
Yeah, and they'll just ignore it because they're taking
else.
everybody, but also remind them that because they're so worried about cancer, cervical cancer, breast cancer, that heart attacks and strokes, that's the #1 killer of women, not cancers. So when you have, markers, red markers like that, or red flags like high blood pressure, things like those, you have to take them seriously.
These are the types of symptoms you definitely don't want to keep a secret. And everyone at home, I want you to be sure to pick up the February issue of Redbook Magazine for more information on these topics. And Jill, thank you so much. We hope to see you again soon.
Thanks. It's great to be here.